Hello viewers, I'm Dr. Suma. I'm a consultant working at 49 Fertility Center, Vijayawada. So all of us have heard about fibroids in the uterus. So fibroids are nothing but small growths which develop from the muscle of the uterus. So fibroids can affect your fertility in certain situations only. So not all fibroids are detrimental for your fertility, but there are a few fibroids which can affect your fertility and need to be knocked off before you plan your pregnancy. So any fibroid which is affecting the uterine cavity or which is distorting the uterine cavity can affect your fertility. So a fibroid which is lying very close to the lining of the uterus, or a fibroid which is present in the muscle of the uterus but it is big enough to cause distortion of the uterine cavity, or a fibroid which is present at the point where the fallopian tubes are opening can probably block your fallopian tubes, and some fibroids which are present at the mouth of the uterine cavity, they are called cervical fibroids. They can block the entry of the sperms inside the uterine cavity. So there are a few fibroids which actually don't distort the uterine cavity, which are lying away from the uterine cavity. These need not be removed at all. So how do you know that you have a fibroid? So usually fibroids are symptomatic. When a patient has a fibroid, she has dysmenorrhea, which is pain during menses. She also has severe menstrual bleeding. So having bleeding which is heavy, that she changes at least 4 to 5 pads in a day, or she passes clots, or she has bleeding which lasts for more than 7 days in a month, then usually it is suspicious of having some pathology which sometimes could be a fibroid as well. So many times fibroids can still be asymptomatic, that is the patient has absolutely no symptoms. But when we do a routine ultrasound examination for the couple, for the female partner, when they come to us as a couple for fertility evaluation, then also we can find these fibroids. So we are not worried about all the fibroids. As I said, only those fibroids which are distorting the uterine cavity need to be removed. So we can do a simple myomectomy where just the fibroids are removed and the uterus is saved. So we can do here a myomectomy hysteroscopically, which is done with a camera that passes inside the uterine cavity, or laparoscopically where the camera is passed into the abdominal cavity. So which method of doing the myomectomy depends upon the number of fibroids, the position of the fibroids, and the size of the fibroid. So leave it to your doctor and they will decide it for you. Post fibroid surgery, we usually suggest a 3 months gap, following which you can try for pregnancy. You can even try naturally, because if everything else is normal, there is always a very good scope of conceiving naturally. Thank you.